Aseptic technique can be defined as a set of specific work practices and procedures performed under carefully controlled conditions with the goal of minimizing the introduction of contamination. This video will focus on using proper technique when compounding sterile products. The IV route is the most dangerous route of administration because it bypasses all of the body's natural barriers. Patients who are receiving intravenous therapy tend to be the most critical, therefore every precaution must be taken to avoid contamination of CSPs. Several studies have repeatedly identified human-borne contamination as the greatest threat to the sterility of CSPs, making this the most critical factor to be controlled during aseptic processing. An improperly prepared CSP can have very serious consequences, including infections, occlusions and/or embolisms, and even death. Every time you enter the hood to perform any task, it is imperative that you spray your gloves with 70% sterile isopropyl alcohol and rub them together vigorously until dry. You will also want to regularly check your gloves for tears and replace them as needed. Avoid touching your face, glasses, mask, or bouffant cap. If this cannot be avoided, you must don a new pair of sterile gloves in the donning area before returning to any compounding. Picking anything up off of the floor and continuing to compound in the hood is strictly prohibited. Simply slide what you have dropped out of the way, finish your compound, pick up what you have dropped on the floor, and then change your gloves. Always disinfect your materials before entering them into the laminar flow hood. Only sterile materials should be placed inside the hood. Make sure that all of your items are disinfected properly to avoid possible contamination of the workbench by wiping each item with 70% sterile isopropyl alcohol and cleanroom approved wipes. This includes IV bags, all vials, ampules, syringes, and needles. Always work at least 6 inches in from the edge of the work surface, remembering that the work surface edge is the dirtiest place in the entire hood. Maintain good posture when working in the hood. Avoid slouching, resting your arms, elbows, and hands on the work surface. Only bring into the hood what is needed for each compound, focusing on one preparation at a time, ensuring that each item is spaced apart so as not to disturb the patterned flow of air. Swab all points of entry using 70% sterile alcohol swabs with firm strokes in the same direction in order to prevent contamination. Before opening a glass ampule, use a clean alcohol swab to clean the ampule. Face the breaking position towards the side of the hood and break the ampule open. When opening any items in the hood, always peel them open as intended by the manufacturer. Never tear packaging open or push the item through its packaging. A critical site is the part of a supply item that includes any fluid pathway surface or fluid pathway opening that is at risk for contamination by touch or airflow interruption. Identifying the critical sites of items used in sterile compounding is imperative. These sites must never be touched by anything that isn't also sterile, and the airflow between the HEPA filter and the critical site should never be interrupted. This is known as shadowing. The critical sites of a syringe are the tip and the plunger. And the critical site of a needle is the entire shaft. This clip demonstrates the concept of shadowing. Notice the compounder went completely over the top of the vial and broke the airflow between the HEPA filter and the critical site of the vial. In this clip, the compounder places the vial far enough away so as to avoid shadowing and maintaining constant airflow from the HEPA filter to the critical sites. If airflow to a vial is disturbed, re-swab the vial with a clean alcohol swab and allow it to dry. Watch as the compounder aseptically withdraws all of the solution from the ampule, changes the needle to a filter needle, and enters the solution into the vial. If the airflow between the HEPA filter and an open ampule is disturbed, the ampule must be thrown away. To prevent coring when penetrating the rubber closure on the vial, use the following technique. Position the needle point on the surface of the rubber closure so that the bevel is facing upward and the needle is about a 45-degree angle to the closure surface. Put downward pressure on the needle while gradually bringing the needle up to an upright position. Just before penetration is complete, the needle should be at a vertical 90-degree angle. If a syringe is dropped inside of the hood, do not reuse it. Obtain a new syringe, cap it with a new needle, and start again. If you drop a syringe with a needle on it, you can still use the syringe, but you must change the needle. And finally, never spray anything directly into the hood.